And the time is 1:01, it looks like. I call this meeting of Health, Finance, and Policy Committee to order, and members, we have quorum. Representative Franson, have you had a chance to look at the minutes, and would you like to move their approval?
You know, Mr. Chair, I'm so glad that you chose me today because I actually have read the minutes and they look amazing, so let's approve them.
All right, thank you, Representative Franson. I knew you always read them, so I didn't have to ask you ahead of time, so.
Exactly what I do in committee. If those that aren't paying attention get called on.
Here you go. Representative Franson moves approval of the minutes. All those in favor say aye. Aye. All those against say nay. The motion prevails and the minutes are approved. Okay, members, the first bill on agenda today is House File 1501 from Representative Murphy. So just to give members a lay of the land, this bill we're looking to take about 10 minutes. And then House File 22, roughly about an hour and 15 minutes to 2:30, and then Representative Bahner's bill, the last 15 minutes. We have reserved this room for tonight with the snow and everything. Would love to not to have people travel late at night, so just please keep that in mind. So with that said, the chair moves House File 1501 before the committee with the chair's intent to lay the bill over for possible inclusion. Representative Murphy, to your bill.
Thank you, Mr. Chair. Appreciate it. So this is House File 1501. 1501 appropriates money to the general fund for the Rare Disease Council, which we're under statute to do. It appropriates money for the 26 and 27 year cycle, and it's in the area of $342,000 to run the Minnesota Rare Disease Council. It's interesting at the Minnesota Rare Disease Council, it's its own agency. And I'm actually on the council there, along with Representative Ryer from the House and also 2 senators. But it's a unique environment that we are actually voting members of the council, and we have some real oversight and availability to really help with the council. We are advisory. We're a great source of information for those who struggle to find it. Our efforts shorten the time of diagnosis to those that urgently need it. We help accelerate research through our participation in the process. The council is advised of key industry players made up of expert members. In Minnesota, we are actually one of the leaders, a world leader, with the help of the University of Minnesota and the Mayo Clinic. We stand alone in the country as one of the premier councils for rare disease. We've been advised about and advocate for cutting edge technologies like gene therapy. We've been able to accomplish great things with sickle cell anemia and hemophilia. And so it's a great opportunity for Minnesota to lead, and really appreciate your consideration of this bill. Thank you.
Representative Murphy, I believe you have a testifier. If they could introduce themselves for the record and proceed, please. It looks like Aaron Barnes.
Erica Barnes.
Erica, oh, we're close. Get a point in horseshoes. Go ahead, Erica.
No problem.
Introduce yourself, and I would ask you to keep your testimony to 3 minutes.
Okay. Chair Backer and members of the committee, thank you for the opportunity to testify in support of House File 1501, which would establish Minnesota RDAC's current fiscal year 25 budget as the permanent base. My name is Erica Barnes, and I'm the Executive Director of the Minnesota Rare Disease Advisory Council. The Minnesota Rare Disease Advisory Council is a state agency established in 2022 whose mission is to improve care for the 1 in 10 Minnesotans living with a rare disease. Our aim is to provide comprehensive policy recommendations related to rare diseases to legislatures and other state agencies, develop support tools for the medical community, and convene and unify small patient communities working in isolation and often duplicating efforts. When the council transitioned from the University of Minnesota, we worked closely with the small state agency resource team at Minnesota Management and Budget to identify a budget that would allow us to meet all of our compliance requirements associated with being an agency, as well as what we would need to execute on our directives that are laid out in statute. There are roughly 10,000 rare diseases, and when considered collectively, they affect 25 to 30 million Americans. While the underlying causes are varied, the striking commonality among these diseases is the barriers to care that an individual faces when encountering our healthcare system. At every point along the healthcare journey, rare disease patients face unique barriers over and above what these individuals with common diseases face. From years-long delays in diagnosis to a lack of a primary care doctor who has any knowledge of the disease, to only 5% of rare diseases having any FDA-approved treatment, it is no wonder that Abby Meyer, the founder of the National Organization for Rare Disorders, once said, "Families affected by rare diseases represent a medically disenfranchised population that falls through the cracks of every healthcare system in the world." And these inefficiencies in diagnosis and management represent a significant cost to our healthcare system as well. I submitted a document for your review that talks about the cost burdens of rare diseases. Due to their medical complexities and the difficulties providing coordinated management, a recent NIH cost burden study found that healthcare costs for people with rare diseases are 3 to 5 times greater than the cost for people with more common diseases. So it's costing the state of Minnesota not to prioritize the management and care of these patient populations. However, and ironically, in the last several years, the rare disease community has become ground zero for some of the most innovative medical advances in decades that are transforming medicine as we know it. Treatments such as gene therapy have opened the possibility of greatly alleviating or even curing diseases which were once out of the reach of medicine with a single administration. But these disease-modifying treatments come with high upfront costs and shatter the current reimbursement paradigms that are more designed to pay for chronic diseases over a lifetime. In order to take this transformative therapy from the lab to the clinic and actually deliver it to the people who need it, we will have to identify policies to reshape our healthcare delivery landscape. The Minnesota Rare Disease Advisory Council is grateful for the funding from last session that allowed us to operate on the budget that we identified as necessary to execute on our work. With that funding, we have been able to convene the rare disease community more regularly. I'm so sorry. So there's a lot to be done, and I just ask you to please fund the Rare Disease Advisory Council. Thank you so much.
Thank you, thank you. Time always goes quicker than we want, so, and that happens when you work with Representative Murphy, too. So, would there be anyone from the public that would like to testify? Okay, seeing none, I close the public testimony. Members, I open it up to questions and discussion. First on the list is Representative Hewitt. You have the floor.
Thank you, Chair Backer, and this is more of a statement, and I really appreciate Representative Murphy and Representative Ryer. We as members have very limited time, and we're assigned to these boards and in committees like this, and I really appreciate the fact that you're actually engaged with it, and that's really important because you are bringing their legislation forward, and you are our eyes and our ears on this, and so thank you, and thanks Representative Ryer. Thank you, Chair.
Yeah, and just to let people know before we go to the next one, we do have two representatives that are on Zoom because they couldn't make it in today. So with that, we have Representative Liebling. Go ahead, please.
Yeah, thank you, Mr. Chair, and thanks for the presentation. I really have questions about the budget, and the bill is about the budget. And Ms. Barnes, maybe you could just explain like what the current budget is. I thought you had like an ongoing budget, but the budget, so the bill before us, is that additional money? So it almost doubles your budget, as I understand it. Could you please explain like why you want your budget to be doubled?
Sure.
Go ahead, Ms. Barnes.
Chair Backer, Representative Liebling, so the current amount that was appropriated last year was $668,000. Part of that is an ongoing base, and the rest of it was a one-time appropriation. But that was the amount that we identified. It's very comparable to other state agencies. In fact, it's on the low average end of other state agencies. And I think I submitted a document with line items of how we're using that money. I can go into a few of those details if you would like, but that was the money, that's the amount that we've been asking for since we were established in 2022, and we identified that at that time. So we've been trying to get that amount that was initially identified. So it is that the amount that the 668 is what we're operating on this fiscal year.
Follow-up, Representative Liebling?
Yeah, thank you, Mr. Chair. Well, I mean, we are here to discuss the budget, I assume, because we have a budget bill in front of us. So I don't know, I don't think I got that document, but and I'm not sure if the committee got the document, but I would like to understand what, since you're asking to double your budget, and I understand we gave you a one-time appropriation last time in addition to your base budget. So I do think we need an explanation of, you know, what you plan to do that you're not doing now.
So the base amount that's ongoing is 326,000, I believe, and then the 326,000 that's ongoing. And then last legislative session, we've been asking for the 668. Last legislative session, 342,000 was given as a one-time. We're looking to get that full amount so we can continue the work that we started, that we were appropriated last legislative session. So yes, in one sense, it's doubling it from what we were appropriated, but in the other sense, it's what we've been asking for since we were established in 2022 as what we identified as needing for our work. If we don't get that amount ongoing, then we'll go back to having 1.8 FTE. So before the one-time appropriation, I was operating with 1.8 FTEs. State agencies typically have an average of 4 FTEs to do the work. And there are some programs that we initiated with that amount that we would have to just stop doing if we go back to the 326,000.
And members, this bill will be laid over just because of our timeline. I'm going to go to our next member question, which is online. We have Representative Hemmingson Yeager. Go ahead, please.
Great, thank you, Chair, and thank you, Ms. Barnes. I just want to make a comment and just say that I have really appreciated their collaboration and their partnership, my first biennium and ongoing. Having a council of experts across the lab, across the clinic, and across all of the policy areas has been extremely valuable in keeping up with this crazy cutting edge technology and giving real tangible advice as I continue to work in the genetic and rare disease space. So I just want to give my full support for this bill. Thank you.
Okay, members, due to our timeline that we have here, I am going to have Representative Murphy please close on your bill.
Thank you, Mr. Chair. I would just like to say that, you know, this is a very well-tuned machine. Ms. Barnes has done a great job with directing this out of the chute as a brand-new agency, so certainly isn't a big ask for what we're doing. And we're cutting edge, and Minnesota is an industry leader here. And so we want to make sure that we take advantage of all of that. I have a personal story with rare disease, so this was something that I thought was interesting, but I didn't realize until after I was in it that actually I have 3 kids that would all be classified as having a rare disease. It was the same disease. It was febrile seizures, and to be a rare disease, you have to be less than 200,000 in the United States cases. And so we went for a long period of time from when our child was 1 year old to about 6, and he would have seizures. And we sought a lot of help. And then we ended up, and when he was 6, 5 years later, we ended up at the Mayo Clinic. And they said, we can fix this. And they also said that the young man sitting right beside him has the same issue, but we're so glad you're here. And so when it comes to rare disease, it's really about diagnosis and making sure that people are advocating so that these groups get together. Because when you have 200,000 in the country, you don't know many of them. And they don't know, and the doctors don't know it either. And so it really was a big help. That changed his life. Today he's an engineer with SpaceX. And so it completely changed his life. And it completely changed us. We couldn't even send him home with anyone when he was young because they had to know what to do. So rare diseases are real things. We are cutting edge with our technology today, and we can make a huge difference with this. So this is an important bill, and it's an important ask. So thank you for your consideration.
Thank you. Thank you, Representative Murphy and Director Barnes. The chair lays over House File 1501 for possible inclusion in the omnibus bill. The next on the agenda is House File 22 from Representative Gillman. Again, it's my intent that we go up to around 2:30 on this bill. Representative Gillman will be, as you come to the table, the chair moves that House File 9. No, 22, oops, typo. House File 22 be referred to the Committee of State Government Finance and Policy. So Representative Gillman, I believe you've been hard at work on your bill, and you have a A5 amendment. The chair moves a A5 amendment, but before adopting the A5 amendment, can you please explain the amendment there, Representative Gillman?
Thank you, Chair and members. Yes, I just want to point out, I did not bring snacks, and I do commit, boo-hoo, but I will be bringing snacks next time. Thank you, Representative Franzen. I want to be like you, so I'm going to bring snacks. All right, so the A5 amendment, we can just break it down. Lines 1.2 to 2.24 modify when a parent can access a minor's health records. The amendment would allow a parent to access a minor's health records when the minor consents to health services, except it maintains current law, that a parent cannot access a minor's health records if the minor is living apart from the parent and are financially independent or has been married or has borne a child. Lines 2.25 to 3.20 require healthcare providers to allow a parent to be in the examination room when the minor is receiving health services, and require healthcare providers to provide parents with notice of standard questions the provider will ask the minor as a part of the health visit. These requirements do not apply to a minor who is living apart from a parent and financially independent, or has been married or has borne a child, to examinations involving suspected cases suspected cases of physical or sexual abuse. And then we did decide to move in lines 3.21, we changed the coding. So that was recommended in one of our first committee stops, that the Parent Bill of Rights move from Chapter 260C to Chapter 257, because it's titled Children Custody and Legitimacy. And then again, in lines 3.22 to 4.9, and then again to 4.12 and 4.13, we're just consolidating the language there and putting it together. And lastly, on lines 4.10 to 4.111, provide a parent cannot access the medical records or physical samples of a minor who consents to health services, again, back down to because of their exemption status on that. So that is the A5 amendment in whole.
Members, are there any questions on the A5 amendment? Okay, the chair moves to adopt the A5 amendment. All those in favor say aye. Aye. All those opposed say nay. The motion prevails and the amendment is adopted. Representative Gillman, please present your bill as amended.
All right. So again, thank you, Chair and members, for this opportunity to present House File 22, also known as the Parent Bill of Rights. At the request of the committee chair, I will be focusing this presentation on the provisions related to health and the jurisdiction in this committee. The Parental Bill of Rights seeks to ensure the fundamental rights of parents. And the intent of the bill is to love and support our kids while ensuring children receive the guidance and care they need at critical moments in their lives. I just want to emphasize again that the bill does not create new rights or fundamentally alter existing law. Instead, it reinforces and clarifies rights that are already recognized in Minnesota statutes. Another thing that many parents have brought to me is that this bill supports the diverse Minnesota, from our tribal to immigrant, traditional, non-traditional families. We are all different, and freedom is what it all looks like with this bill. We want to ensure that we retain our cultural values, and it does not restrict them, but provides more freedom and opportunity to love our children. Again, I will continue to work with folks along the process, and I'm excited to have our testifiers be with us today, and we'll have more questions as the day goes on.
Okay, thank you, Representative Gillman. We have testifiers. We have 4 signed up. First one will be Matt Flanders. You're on, if you could come to the table. After Matt will be Dory Torsen, and so those are, and then we have two more. So please state your name and would ask your testimony to be limited to 3 minutes, please.
Thank you, Mr. Chair. My name is Matt Flanders, and I'm the Legislative and Policy Director at Citizens Council for Health Freedom, a national nonprofit health policy organization based right here in St. Paul. Our mission for 25 years has been to protect patient and doctor freedom, and I'm grateful for the opportunity to provide testimony today on House File 12, and I'd like to thank Representative Gillman for carrying this important bill. Our organization fully supports House File 12, which includes clear protections for parent and guardian rights, including House File 22, consent rights for treatment, full access to medical records, consent rights for specimen collection, and more. We also appreciate the addition of the A5 amendment, which further clarifies the parents' rights in the exam room. I think we can all agree in this room that we want to do what's best for children. The question then becomes, what is best for a child, and who gets to decide that? Each person here likely has different ideas on parenting, what things to discuss with children at different ages, what things they are comfortable with their child discussing with another adult at different ages, and what age to let children start making certain decisions. There are likely many differences of opinions on what to do for various treatment options and more. Our belief, again, is that the parent, with the guidance of and input of healthcare professionals, is in the best position to make those decisions. By not having a clear state law outlining parental rights in the exam room, a hospital or clinic can even unintentionally put a parent or guardian in the unfortunate position of being at odds with their minor child. For example, when a person in a position of authority, such as a doctor or nurse, tells a child that keeping parents in the exam room is their decision, not their parents', it can undermine the role of the parent or guardian in front of the child. And it can introduce the idea to the child that it's okay to keep secrets from their parents. While we wholeheartedly support the ability of parents to allow their child to be part of conversations regarding healthcare decisions and to discuss sensitive topics alone with a healthcare professional, that decision must be made by the parent or guardian. The fundamental question here is who should get the final say? Is it the parent or guardian? Is it the child, or is it someone else? There may be remarks today from individuals who do not believe that the parent should have these rights for a variety of reasons. These reasons may sound good, and they are probably with the best of intentions, but they do not and should not supersede the right and responsibility of a parent and a guardian to be involved with and in control of the care being given to their minor child. In conclusion, we fully support House File 22, which protects and clarifies the rights and responsibilities of parents. We also appreciate the protective language allowing for a minor to receive care if they need life-saving treatment, and the exceptions for cases of abuse. Once again, we are grateful to Representative Gillman and all the co-authors, and we urge this committee to support this bill. Thank you.
Thank you so much. Next on to approach the table, it would be Dory Torsen. And then we will then take two testifiers online on Zoom. The first one will be Christina Barton. So please state your name, and we will ask you to keep your testimony down to 3 minutes, please.
My name is Dory Trossen. I'm here to support the Parental Bill of Rights because a Parental Bill of Rights would have protected my child with a rare autoimmune disease. Much like you heard earlier in testimony, my son had a disease that that was hard to diagnose. And we were in the middle of diagnosis when he was hospitalized for dehydration from a stomach bug. During that stay, the doctor was not aware of the disease, and every time we brought it up as we were waiting for the specialists, they told us, quite frankly, they didn't believe that disease existed. And because of that, he was put through different foods that we knew to cause anaphylactic responses within him. He was required to do that basically every day for 8 days. So every day we had to watch our son go through anaphylaxis on foods that we knew and told the medical professionals he was going to have a response to, and he had to continue to do that. And every day when we came to the table to talk about it. I said, clearly you can see what's happening here, and they would not listen. When they were not in the room, I was on the phone with specialists from other hospitals trying to find care for my son. At one point, we did find a mast cell activation syndrome specialist out of the U who offered to see him. We offered to take him there. We asked to take him there via ambulance so that he could get the care he deserved. We were denied. We were said if we walked 1 foot out of that room, we were calling CPS on us, and he was going to be removed from our care. It was a very, very hard thing to watch because every day I had to pray that my kid was going to live another day. This is why I started coming down to the Capitol 7 years ago to talk to my representatives, because what happened to him was not right. He was 1 year old. He had no choice in the situation, and all I was trying to do was advocate for his needs. It was awful. And so it's kind of fortuitous that we had someone talking about rare autoimmune disease or rare diseases in our state, and understand that that's true, that kids can and adults can go through a lot of misunderstandings with their medical professionals. But they did not let us have a seat at the table during that time. They did not allow anything that we brought forth from any specialist, from our doctor, from anyone to be heard. They would walk out of the room and an hour later come back and tell me they didn't believe it existed. It was one of the hardest things I've ever experienced in my life, and I am very, very lucky that my son is still alive today. At the end of that, he could not eat. He had to be on 16 medications a day to keep him out of anaphylaxis. What they did was wrong. They would not listen. This is why a parental bill of rights in regards to healthcare is so important, because rare diseases do exist, and parents who've gotten the higher end on that are not being heard, and children are being harmed. So I ask that you very, 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 very much consider supporting this bill. Thank you.
Thank you, Doreen. Next we have is Christine Barton, online Zoom. I hope I got that right. And then we have Abby. We have Abby, we'll say. Okay, Christine Barton, go ahead, please. Unmute it, please. We're not hearing you.
My apologies.
There you go.
Good afternoon, Chair and honorable members of the committee. My name is Christina Barton, and I testify before you today as a licensed school counselor, a devoted mom, and a passionate advocate for parental involvement in their child's healthcare decisions. I am here in strong support of HF22, I apologize. In my professional experience, I've witnessed firsthand the profound positive impact that active parental involvement has on a child's well-being, particularly when it comes to making informed healthcare and educational decisions during their formative years. This is why it's critical we consider the emotional and cognitive development of children when making laws that affect their future. It is widely recognized that children's brains, particularly the prefrontal cortex, are still developing until around the age of 25. The area of the brain is responsible for decision-making, impulse control, and understanding long-term consequences. This isn't just a theory. This is basic common sense. We already understand that children are not ready for adult decisions in many important areas of their lives. For example, they can't vote, enlist in the military, or enter adult spaces like strip clubs or adult bookstores until they are legally adults. They can't buy cigarettes or alcohol until they're 21. Why do we have these laws? It's simple: to protect children. These restrictions are in place because young people are not developmentally prepared to make irreversible decisions with long-lasting consequences. In Minnesota, children are not legally considered adults until they are 18. So the question becomes, why would we allow children under 18 to make other adult decisions, especially those that could affect their future health and well-being? If they are not recognized as adults by law, then why should they be making adult decisions that they do not yet fully understand? This is where parental involvement is critical, especially in sensitive matters like gender-affirming care, which can have life-altering consequences. Some may argue that excluding parents from these decisions is a form of protection, But the truth is, research shows that parents are the most important advocates and protectors for their children's health and safety. Moreover, studies indicate that engaged and supportive parents significantly reduce the risk of suicide and self-harm along the LGBTQ+ youth. Parental involvement is crucial to the emotional well-being of all children, and excluding parents from these discussions undermines the support and protection that children need. In closing, I urge you to support HF 22. This bill ensures that parents remain the primary decision makers in their children's health care, empowering families to make choices together in the best interest of their children. Thank you for your time and consideration. I encourage you to refer to my written testimony, which provides further psychological research supporting this important issue before voting on this bill. Let's ensure that parents remain at the center of decisions that shape their children's health and future. Thank you.
Thank you. Next on Zoom is Abby Yost. I hope I have that right. So you have 3 minutes, please. Share your name and go ahead, please.
Good afternoon, Chair and members of the committee. Thank you for the opportunity to speak today. My name is Abby Chose, and I am here to voice my strong support for HF 22, the Parents' Bill of Rights. I'm testifying today on behalf of thousands of Minnesota families that Minnesotans for Health and Parental Rights have represented and supported for over a decade, many of whom are represented in our full written testimony you should have each received. Our families face very real struggles navigating a system that too often sidelines parents in critical decisions about their children's health and education. While their stories are documented in our written submissions, many parents were unable to testify today due to short notice, work constraints, parental responsibilities, or fear of potential consequences in an increasingly polarized climate. As a parent, I believe no one is more invested in a child's well-being than their family. Yet across Minnesota, parents are finding themselves locked out of medical decisions, denied access to records, or even threatened with CPS involvement for seeking second opinions or alternative care. Families have been pressured, misled, and in some cases outright ignored when advocating for their children. This is not how a compassionate and just society should operate. HF 22 is not about politics. It's about restoring trust, common sense. Parents should not have to fight for basic access to their children's medical information. Parents should not be forced out of exam rooms, silenced in schools, or made to choose between their rights and their children's care. When parents are empowered, children thrive. When families are respected, communities grow stronger. This bill provides necessary protections to ensure that parents are recognized as the primary decision makers in their children's lives. It creates clarity for families, healthcare providers, and educators so that collaboration, not conflict, becomes the standard. Thank you for the opportunity to be a part of this continuing conversation by sharing our experiences.
Thank you. Before we go to public testimony, I want to point out to the members in your packet is several written letters. So would encourage you to take a look at them. Would anyone else from the public like to testify? Okay. Seeing none, public testimony is now closed. Members, I will open up. If you could please come to the table and state your name. You could do it for or against. So please state your name, and you have 3 minutes.
Hi, my name is Megan Beecham, and I am testifying against the bill, House File 22. My reasons for urging you guys to not vote in favor of this bill is because I, as a queer person, grew up in a family that I don't share their values and their faith, and I had to, on occasion, lie to them about my identity, And had I not had to worry about them having control over my life, and this was back before conversion therapy was illegal for minors, I had to make sure that that wasn't something that I ended up getting exposed to. So I know that's not necessarily an argument centered around healthcare, but because my understanding of it is in regards to decisions in general, I would say that in order to protect LGBTQ youth, it could be detrimental. And sometimes, yes, parents are responsible for protecting their kids, but sometimes parents are also the ones that kids need protection from.
Okay. Thank you. Thank you for sharing your experience and testimony. Anybody else in the public would like to testify? Okay. I am now seeing none. And so public testimony is now closed. Members, I will open up to questions and discussions, which will go up to around 2:30. And first on deck is Lee Bierman. So you have the floor.
Thank you, Mr. Chair. I wanted to just start the questions for the author on the fiscal note, and wondering if Rep. Gillman had requested a fiscal note.
Representative Gillman.
Thank you, Chair. At this time, there's no fiscal note that's been requested that hasn't been needed.
Okay.
Not been needed.
Okay, Representative Bierman.
So let's go on to, I'm surprised there's not a fiscal note requested. That would be interesting to hear and understand what implications there might be on some of this. But I want to go to a question on we're hearing a lot about, Rep. Gillman, we're hearing a lot about parents needing to get their rights back. Can you go in a little more detail and tell us some of the parental rights or examples specifically that you feel parents have lost?
Representative Gillman.
Thank you, Chair. I will find a few spots here. Can you give me a minute? All right. Okay. All righty. I am going to, I'll talk about one thing. And I appreciate the testifiers that were here in support of the bill and also those that are opposed. When parents are left out of the equation, when they're left out of conversations that could be happening in a healthcare situation, be it in an exam room because a parent is not allowed to be in it, to be able to access health records when you're 13 years or older, needing permission to access those health records, having those conversations with our kids and being able to love and support them and make decisions with them on potentially life-altering decisions for their lives is in the best interest of the parent and the child. So I'm going to stick with that. Thank you so much for that question.
Representative Bierman, follow-up?
Yes, please. Thank you, Chair Backer. So just, what I'm hearing is that you're suggesting that parents are locked out. And I think that, I've raised two kids. I've been to their doctor's appointments. I've never experienced not being able to be present in the exam room with my kids when the doctor is managing their care. So I think we hear a lot about this, but I don't hear a lot of examples. The one thing that I do hear sometimes is, for some mental health treatments, especially in schools, kids sometimes are at school and they need to talk to a counselor, and the counselor sits down with the child who needs some help, needs an adult, needs somebody to talk to and that will hear the child. And I'm concerned when parents want to interject in that mode when there are no imminent dangers to the child or others. And so I've talked to counselors about this in schools here in Minnesota, where there is some ability for the child to have some privacy and not have to report all that to line by line to parents. And it takes an extraordinary amount of time in states where they have restricted students' ability to have counseling without a parent present, or to restrict the counselors to report on every single conversation with those kids. And it results in students not getting the mental health treatment they need often when they don't really want their parents involved, and it doesn't rise to the level of danger to the student or to the parent. So I'm concerned about bills that are so vague in their descriptions about what it is that parents are getting their rights back, and there's not really much depth to how you can, with examples, say exactly what the problems we're supposedly experiencing are now. So the vagueness of this bill is very concerning to me, and just think that there's a lot more we're going to explore here today. Thank you.
Okay, Representative Purcell.
Thank you, Mr. Chair. This is maybe a little bit off the topic, but I guess I heard in some of the testimony that there's an exclusion for minors who are married. And I wonder if that is the case, and that's law in Minnesota, and maybe research can give us more information about that, because that is troubling to me. Thank you, Mr. Chair.
Go ahead, Ms. Clark-Chris.
Mr. Chair, could you restate the question? I missed the beginning part of it. I apologize.
Go ahead, Representative Purcell.
Thank you, Mr. Chair. I guess I'm asking the question on if it is legal for minors to be married in Minnesota.
Go ahead, Ms. Clark-Chris.
Madam Chair and Rep. Purcell, I don't know the legal age for marriage in Minnesota, but this would apply to any minor that's in the state. So I think states have different legal ages for marriage. So if a minor came into the state from a state that had a lower, that allowed minors to marry, it would apply to them as well. But let me look, and I can provide further information.
Okay, Representative Purcell, follow up?
Okay, thank you.
Or another question?
Yes, I would love that clarification. And I mean, I think we heard, testimony from Ms. Barton that, there are certain things that we don't allow our minors to do, like serve in the military or vote or have cigarettes. And so when I heard that there's an exclusion potentially for minors who are married, that just raised a red flag. So I would be interested in that information for follow-up. Thank you, Mr. Chair.
Okay, Representative Hewitt.
Thank you, Chair Backer and Representative Gillman. I appreciate where you're going, and I have great sympathy for the parents that have experienced what happened here. And as much as I hate to say it, I think in my experience, these are outliers, as I've worked in emergency medicine for at least 10 years out of my life, and then as the chair has worked on the street, I have also. And we have rules that we always had to follow, especially when it comes around to children. And I guess my first question is, have you consulted with Children's Health of Minnesota, Masonic, Gillette, any of our children providers to see if they recommend anything in the bill? I'm just kind of curious because they all have patient advocates that center around exactly this topic. Have you consulted with them and brought them into the mix here? Because I don't see them here today.
Representative Gillman.
Thank you, Chair. And the answer is I've not contacted any hospitals or Gillette. I can't remember what other ones that I've not consulted them. I've worked with House Research. Many, besides that, folks that spoke today, I've talked with counties, I spoke with schools, superintendents, school nurse, but not a specific hospital. I have not spoke with them.
A follow-up, Representative Hewitt?
Sorry, Mr. Chair and Representative. That, as a healthcare provider, a former one now, I guess I'm a legislator today, I guess that does kind of concern me because these are the people that deal with this crisis every day. And it maybe would have helped you a little bit with the bill to get it in a position where we heard really compassionate stories from the parents, and I empathize with them, but I don't think that that's a common thing. I just know that I've been involved in situations that involve minors, especially adolescents. That's who I think we're going to have a lot of heartburn with here because they really do want, I mean, we all remember growing up in middle school, right? We want our privacy. And I think that that's going to be an area that I think is going to be the biggest question here. I would recommend that as this bill goes forward, that you probably bring them into the mix. And then also, I guess, does this apply, does a child have any rights at all? So, I mean, I guess even if I get arrested on the way home tonight, I'm going to be advised of my rights. Does the doctor in your bill anywhere say that a child could, that they're talking to the patient in front of the parents? I've seen this happen. Anything you discuss with me, I have to discuss with your parents and show them the record. Is there any way that that doctor in your bill has to do that so the patient knows that that their information will all be shared? Or is it just assumed and the patient should know that already? Because there's pretty smart middle schoolers, they're pretty smart kids. Is that in the bill anywhere?
Representative Gillman.
Thank you, Chair. And I'll first go back to really quick to your first point about reaching out for more broad feedback on the bill in regards to hospitals. Again, the best advocate for our children is the parent. And again, so when you think about our child being a patient, we have to do our due diligence and work alongside the doctor. And when you go back to, like, does a minor, it isn't changing anything for a minor under certain circumstances to be able to consent to medical treatment without the consent of the parent. And I specified that in the beginning, which line items and situations and circumstances that would be. But what my bill does do now is that when there are health decisions being made, that the parent would be notified to be a part of it. Again, I want you to think about folks in the room and parents that are listening online. I think about Crystal, my 15-year-old buddy that was my best friend, that again, and I appreciate the testimony of the testifier earlier, who was scared to tell her parents something. Okay, Crystal was really scared. She was so scared that she waited till she was 4.5 months pregnant to decide to end the life of that baby through abortion. And it took several days because she had fear around it. And I know that that's been a concern of the body here. Well, what about these scared kids? I think we need to look at fear and who best is to be there to calm our children's fears. It's me, to my 5 kids. It's not a doctor. It's not, we will use tools from a doctor, from the counselor. In here, minors can consent to treatment, mental health treatment, to SUD treatment, things like that. They can consent to doing that. We're just saying, parents, please get notified so I can get boots on the ground. I wish I could go back in time because I would have gone and I would have met with Crystal's parents and been that bad friend that would have said something. And she, from that decision, did suffer immensely for years because of her situation and almost ended her life because of her decisions. And she felt the secrets and our maturity was not there. So that, I'm just saying, that's one situation that I personally can think about. So the main intent of this bill, again, is to provide love and support to our kids as parents and to be a part of those conversations and not let our kids suffer alone in their rooms or try to reason it out with another adolescent,
Okay.
Mr. Chair? one more
Follow-up, go ahead.
Yep, thank you. Again, in that subject area, I think that's why this bill needs to be you've done a lot of work, that's obvious, but I think you need to bring more people into the room, even if they don't agree with you, as we do when you sit on the opposite side of the table. And so I think that we together, to get this bill where we need it, really needs to be, we need to see some of these advocates that have dealt with this in real time. I guess my last concern with this, in EMS, and Representative Bahner knows this all too well, we operate under rules of implied consent. If we have a minor and there's no parent around, they're going with us and we're taking them to the hospital, and they're gonna get the treatment that we can allow us, that we're allowed to do under our protocols. If patients tell us something, we don't report that to a family member because we answer to a physician. So I think there's a lot of things in the law that we have to look at here, because even though a patient tells me something in confidence, there's more assessment that has to be done by a medical professional higher than my training. And I think that we have to kind of look at that avenue too, because just because I assess something with my minimal training doesn't really mean that it's there and that it has to be assessed by someone higher. So I think there's some work to do there, but I appreciate your efforts here. I get where you're going. But again, I would recommend a little bit more work on this and bringing more people to the table. I think you'll get a much better bill. Thank you, Mr. Chair.
Sure. Comment there, Representative Gillman?
Yeah, thank you, Chair. And again, I just want to touch on again, emergency treatment. This bill does not modify or change EMS or emergency services at all. So that is one thing that we did do a lot of work on with House Research. Again, and it's mentioned in statute in 144.344. So that does not change, and we did ask that thing, did ask about emergency situations, so thank you.
Yeah, hi. Hi, Dan. I'm sorry. I'm thinking ahead. Folks, we have, just to keep people on track, we're doing good. We got 37 minutes left. We have 5 people on the list. And next on deck is Representative Mahmoud.
Thank you. Thank you, Chair. Thank you, Representative Gillman. I'm just looking for clarification on 1.13 when we have, without demonstrating that the potential infringement of parental rights is reasonable and necessary to achieve a compelling state interest. Can you help me understand what does that look like? What does that mean?
Representative Gillman.
Thank you, Chair. Again, that is just, we had to adopt that language when we were at our first committee stop to make sure that we were within the right framework of what the bill's intent, the Parental Bill of Rights intent was. So we had to have that put in to this section, to this, the parental rights reserved. So it was just language that was adopted through House Research that is a part of just the bill process and law process.
Thank you. Follow-up?
Yes. So do you have an example of what that would look like in real life?
Representative Gillman.
Again, the intent of the bill is to love and support our kids. And so in doing so, in order to bring the bill forward and keep moving through process, that language had to be put in there. So I appreciate that. Thanks.
Okay. Representative Mahmoud, any other questions? Okay, thank you. We are now going to the Zoom, and we have Representative Hemmingson Yeager. You have the floor.
Thank you, Chair, and thank you for the time. I have 2 main concerns. My first is a concern, and then my second is a question. So my first concern revolves around the DNA collection and sampling and testing. I've talked a lot before about genetic testing and how the Minnesota Department of Health has a newborn screening test, which is done right when the baby is born. It tests for over 60 genetic diseases, everything from cystic fibrosis to sickle cell to phenylketonuria, and many other diseases that have titles that are way too long. It also tests for hearing loss. These are tested, approved, part of best practices when it comes to screening kiddos for diseases that can affect them later in life and that they can get treatment for. Now, I know your bill talks about it is an exemption for, if there's something is life-threatening, people can act. And my concern is that many of these tests or many of these diseases do not become life-threatening until they begin to accumulate what happens with these diseases. So they're not life-threatening yet, but they will become life-threatening if they are not identified, diagnosed, and have begun treatment. So my concern is that it is unreasonable to expect parents to understand all of those 60+ diseases, plus their progression, plus the diagnosis, plus the treatment, to truly sit there and sift through all of these things when they are given the opportunity to talk about it with providers, the benefits, they are given informed consent. And so I think to just blanketly assume that parents in the birth of a new child are going to be able to sift through, like I said, all of these 60 diseases to decide what's going on when really time is of the essence and we need to get those test results back is just very concerning to me. My second comment and question comes around public health and vaccinations. We are seeing a huge explosion of measles in Texas, and I just want to make it known that babies under the age of 1 are too little to be vaccinated against the measles. So, and I also want to remind the committee too that there is a targeted effort to scare certain populations of our community against getting vaccinations, which is just a whole other thing that we don't have time to talk about today. So my question comes, if I have a 6-month-old baby and I want to go to my first grader's musical concert and I want to bring my baby with me, how do I know that that baby is not going to get measles or some other type of disease that I cannot protect them against as a parent, as my rights to protect my child? So my question is, when does one single parent's rights supersede other parents' rights?
Representative Gillman.
Thank you, Chair. So I'll just go to the first thing, then when you talked about data collection and also just the first day of when a baby's born. That will be discussed in judiciary, so that will be coming up. And your question again was, when do one parent's rights supersede another parent's rights? The intent of the bill is to empower parents to be a part of the decision, just like they are able to talk with their pediatrician, their doctors. Some people are doing home births. There's many different ways that people are choosing to bring babies into the world. I'm fortunate that 3 of mine came into the world through a birth mother, and I'm blessed that I got to show up in beautiful Florida to adopt 3 babies, and it was an incredible experience. So again, even those situations, because I was not a part of the actual pregnancy and doing all the care of a baby, I got to meet new doctors. And so I believe parents are again, smart enough to be able to have those conversations and figure out what is best for their babies. And it does go back into when a minor can consent to vaccinations, and that is listed in statute 144.3441. So, but yeah, we will be going to judiciary again and talking about data collection there, so thank you.
Okay, follow-up there, Representative.
Yes, please. Thank you, Chair. Yeah, so I wasn't talking about data collection. I was talking about just the actual genetic testing of the DNA. And I would just like to kind of echo Representative Hewitt's suggestions that you might want to talk to some public health officials and to really understand and clarify in your bill how this is going to impact our public health and impact our kids as a community. Thank you.
Okay. We are moving to Representative Ryer. You have the floor.
Thank you, Mr. Chair. Thank you, Representative Gillman. I am a veteran of the HIPAA legislation that was established back in the early 2000s and spent many, many hours working through the nuance of that. And my question to you is that, is this compliant with HIPAA?
Representative Gillman.
That is a great question, and I would love to invite Ms. Clark this to see, would this bill also fall under anything in statute that would?
Go ahead, Ms. Clark-Fist.
Mr. Chair and Representative Breyer, it's my understanding that HIPAA relies on state laws related to minor consent to health services. Is that specifically what you're asking about?
Go ahead, Representative Ryer.
Thank you, Mr. Chair. Really, it's about, my question is about when we determined at the organization I worked at, working with the attorneys, that there were conditions and situations under which adolescents were not required to have the parental consent. And I can read to you from guidance from the federal HHS. Finally, as is the case with respect to all personal representatives under the privacy rule, and I should say that parents are assumed to be the personal representative of a minor, a provider may choose not to treat a parent as a personal representative when the provider reasonably believes, in his or her professional judgment, that the child has been or may be subjected to domestic violence, abuse, or neglect, or that treating the parent as the child's personal representative could endanger the child. And I think that we heard about an example of that from our final testifier today. There are many cases where, in the case of sexual abuse, in the case of reproductive rights, in the case of mental health conditions, many of the things that we've heard about already today, that was deemed, when we were implementing HIPAA, to fall under that. So I'm interested both in whether you agree that the restrictions in your legislation might need to be looked at in light of HIPAA, and also what you would say about there are conditionality things here. The provider reasonably believes in his or her professional judgment. Who decides that, and what are the consequences for that provider if they provide care that they think is right? And that, can this law then come and have consequences against them? I'd like to know what those would be.
Representative Gillman.
Thank you so much, Chair. And again, did you cite that HIPAA description, is that federal? That's federal, correct? And this bill does nothing to change federal law. That's
Representative Ryer.
Thank you, Mr. Chair. My question is, does it comply with federal law? Does it align with federal law?
Representative Gillman.
Thank you, Chair. Again, I would love to call on Ms. Clark-Fist if this would be in compliance with that, or?
Go ahead, Ms. Clark-Fist.
Mr. Chair and Representative Breyer, I think I would need to look into what Representative Breyer has read.
Okay.
Great.
Do you have other questions, Representative Ryer?
May I do one last follow-up?
Yes, go ahead,
Not
please.
exactly the same. Thank you. So my question is then, let's assume that we want this to be consistent with that, and the provider can use their professional judgment. If there is a case, or even if you didn't assume this, if there's a case where it is deemed that a provider has inappropriately cared for a child, spoken to a child, seen a child, what are the consequences? I don't see any consequences in your bill.
Representative Gillman.
Thank you, Chair. That is wonderful. That's a great point to be thinking about. And I will be working with research on this, as well as, reaching out to professionals, doctors, and those that are in the hospital situation, to see under their oath and under their purview of what they do with providing care, if they're protected in their job and in the business that they're in. And if parents could supersede that. Again, we've heard testimony of where parents were not a part of discussions, where many parents have been left out of making decisions with their doctors on that. So, yeah, thank you.
One last-
Representative Ryer.
I just want to say, I think that there's a lot of work to be done with this. I'm going to agree with what I've heard, and I've watched the other hearings as well, and I'm going to agree that this is not ready for prime time. There's a lot of work to be done to make sure that it's legal and valuable to families. Thank you.
Okay, and I would just, the discussion is great. That's one of the reasons we go through the committee process, learning where changes have to be made. So with that said, right now, we still have 2 folks on the list, 2 representatives, and we're 5 after, so this is going good. Thank you, members. And Representative Liebling, you have the floor.
Thank you, Mr. Chair. I'm concerned primarily about a couple of aspects of the bill. So Representative Gillman, what happens if a minor, say, is being abused by their stepdad, and they go to a healthcare provider and, say it's a tween, a 13-year-old, for example, and so the stepdad wants to be in the room for the exam, right? Maybe it's an exam, maybe the child has bruises, maybe, so are you not concerned that in that situation, the child would be unable to tell their healthcare provider that something is happening to them because the stepdad might insist on being right there for the entire examination? I mean, that's kind of a rhetorical question, but here's the thing. This issue about, how much autonomy children should have, it's kind of an age-old issue, right? This is something, their movies are written about coming of age and, how much you tell your parents and what parents know. And we'd love to think that every parent is a good parent. And the problem with this bill is that people look at it and they think, I'm a good parent. I want to know what my child is doing. I will support my child. My child will be helped by my knowledge. But the problem is that the law applies to everybody, and not all kids have good parents. Our testifier who came up, I didn't catch their name, but that was a very brave thing to do, and thank you for doing that, because that was an example. Not every child has good parents. Some children have very bad, destructive parents. And I really worry that even though this bill is well-intentioned, it's for the good parents. I think that it puts bad parents in the driver's seat in a way that can be very destructive and dangerous for children at times. And I know that's not your intent, but this is always there's always a tension between kids getting their independence and parents having a say. This is like, since time immemorial. And my feeling is that if good parents are really good parents, they have a relationship with their child where their child can come to them and tell them things and trust them. And what is in this bill, especially the part starting on line 3.15 about, an exam. So you've got exceptions here for an examination involving a suspected case of child abuse. But the problem with that exception is you already have to suspect it. If a child wants to disclose or would be able to disclose in an exam room, you've now cut off their opportunity to do that, possibly putting their life in danger in an extreme case. So this is very concerning to me. So that's the number one piece. And I'm just going to ask you, well, maybe I'll let you respond to that first, because I have another piece about the genetic testing.
Representative Gillman.
Thank you, Chair. And again, this bill does nothing to stop, or even open the doors for abusers to have more authority to abuse or harm children. Again, having them, this part of the A5 that was adopted today was just, it passed in North Dakota, and it's their language verbatim about being in having the option to be in the exam room. Again, doctors are much more they have more training than with their schooling to identify if there's abuse or suspected abuse going on. And I appreciate having a different way to look at, good parents versus bad parents. This is just for parents in general. This is not to discriminate for or against or to decide if parents are good or bad. Things will come to light in those situations. And it's just when minors can consent to treatments, and then when parents have to be notified, so.
Mr. Chair.
Yes, Representative Leland.
Thank you. Well, Representative Gillman, that's the problem. Whose option is it? It's the parent's option. And you say and I totally get that you're not trying to open the door for abusers, but that's what the bill in fact does. It opens the door for abusers. Notwithstanding that is not your intention, I get that. We all want to protect kids, and we all want to have kids get the best possible, start in life and the best possible support, but that's not what the bill does. The other question I have is, on the original bill, on line 2.16, that you have this provision about that the parent has to give consent in writing before any record of the minor child's blood or DNA is made, shared, or stored, unless obtaining such blood or DNA is otherwise required by law or authorized pursuant to court order. So newborn screening, which Representative Hemmingson-Yager talked about a little bit, is already in law. And about 10 years ago, you may or may not know, there was a whole lot of energy and changes around that. And there was a lawsuit, and, then the legislature made some changes following that. And so now newborn screening there's a very well-established, parents can opt out of the newborn screening, but otherwise, if they don't opt out, the screening is done. So my question to you is, does this language that you've got here override the newborn screening? Does it supersede what we have now for newborn screening, which, as I said, is a very well worked out kind of balancing of interests, and I don't think I need to talk about how important the screening itself is, but that is a really big concern of mine. And I do want to tell you one thing, one piece of that history, and everyone can probably Google it and look up the news articles about this and so on, but part of the settlement of this was that at the time that blood spots that were being held by the Department of Health would be destroyed. And a bunch of blood spots were destroyed, and the parents of those children did not consent to that destruction. That was part of the settlement of the lawsuit, I think it was. And I have to tell you, a lot of parents whose child had their blood spot destroyed were extremely upset that had happened, because as Representative Hemmingson-Yager was describing, sometimes those blood spots can be extremely important to your health later in life, where you could look back, and also they help to discover new tests and help save future lives. So under current law, the parent can say, I don't want you to keep my child's blood spot. That is absolutely in law. But we need to be extremely careful when monkeying around with that law, because it's worked very, very well from that point on. And the ramifications of getting that wrong are very serious. So thank you. If you could please answer that question, does this supersede that law?
Yeah, is there anybody from the Minnesota Department of Health that would be able to clarify this question from Representative Liebling? I guess not. Or, what's that? If you could. Oh, yeah.
Hi.
State your name, please, and thank you.
Thank you, Mr. Chair. For the record, I am Wendy Underwood, Deputy Commissioner for the Minnesota Department of Health. And unfortunately, I'm not able to answer that specific question, but we'll definitely follow up with the committee.
We would appreciate that. Thank you.
Absolutely.
Mr. Chair.
Go ahead, Representative.
Thank you, Mr. Chair. And I was hoping the author could answer it, because this is the author's bill. It's not the Department of Health's bill. And I just would, if the author doesn't know the answer, I would just encourage her to look into it because, you know, if we're moving legislation here, that's a very serious possible impact of this bill. Thank you.
Representative Gillman.
Thank you so much, Chair. And again, when I look at 2.16 to 2, when I read it again here, consent in writing before any record of the minor's child's blood or DNA is made, that's happening at the birth of the child. I mean, they're either choosing to opt in or opt out of that happening. And then if it is stored, again, I believe that the hospital will have to notify if the DNA is being stored or not. So I would love to follow up. I will message Ms. Underwood again to follow up if that would change. But I believe that this would not go against already existing law, but we can do some digging on it. Thank you. And thanks for the history on that as well.
Okay, thank you. We have two more representatives on the list in about 13 minutes. And so Representative Keeler, you have the floor. Thank you.
Thank you, Chair. Thank you, Representative Gillman. So I think I'm looking at the right bill. So if I reference a line, I'm looking at the amendment that you brought today. And these are honest questions. And where they're stemming from is kind of similar to what Representative Liebling was just talking about, is the sexual abuse that's happening from parents and children. In Minnesota, we know that rape and incest is like 1/3 of the incidences that are happening to our youth. And so, honest questions 2.30. I can't find anywhere in the bill or in statute what defines a private area of a minor. I do think that that's important because, like, for some of us, my whole entire body is private. Do you, like, when you talk about private areas of a minor, I do think that that's worth defining if this were to become law so that people can reference that. It's not a large blanket statement. Am I missing somewhere that that's defined?
Representative Gillman.
Just double check here.
I am going to ask for Ms. Calquist. Go ahead, please.
Mr. Chair and members, private area of the body is not defined in the bill.
No, it is not.
Okay, thank you. Representative Keeler.
Thanks, Chair. This is just a suggestion, just in areas when we're talking so much about physical exams, it's just so important that I do think that definitions matter. And I even tried to look in other statutes like across Minnesota, and it doesn't seem like we're addressing that there. So then on the next line, so it goes on to say, the healthcare provider must provide, upon request, a privacy screen or other mechanism to protect the minor's privacy. Upon whose request? If the minor requests that, or is it just only, because like we're talking about parents' rights. So when we say that screen or privacy mechanism is upon request, is this saying that the minor's request will be met and received? So at least in a doctor's office, if our parent is with us, can you clarify whose request we're talking about on line 2.31?
Representative Gillman.
Thank you, Chair. And I could work on the language of that to make that very clear that that would even be on the minor's request.
Okay.
I'd be happy to put that in there.
Another question?
Yeah,
Go ahead.
I do. Thank you, Chair. Thank you for that, because again, those are just the clarifying
Yep.
things that we would never want to misread, that based on the bill, I want that to be the minor's choice. And I'm glad to hear you say that. I do feel like I want to point out some of the statutes that are being referenced here, because I know when people want to talk about unintended consequences, and I know that that's an important thing that we talk about, in line 3.16, we talk about the statute that is actually referencing kids living apart. This isn't a question for you. This is more just a statement to have on record that there's this conversation that's going around. This is the second committee I've heard this bill in, that really talks about, like, if I'm not living with my parents or I'm not around, there is an exception in this language now, which I appreciate you've added, that actually says if a minor is living separate or apart from their parent or legal guardian, this doesn't apply. Is that right? Am I reading this exception right? And so a lot of the concerns that we have heard in other areas have maybe been addressed by leaning into statute 144.341.
Representative Gillman.
Thank you, Chair. Yes, that's correct. That's existing
Okay.
law.
Yep, so I think sometimes we get caught a little bit in the big picture. And to be honest, not that I'm trying to help your bill at all, but I do think that it's important that we read and understand the statutes that are exceptions in the space. And so I do appreciate, because we do have children from our queer community to other communities that when they become 16, 17, 18, they do leave their parents, they do leave their home. And so this is providing, and I just want on record, so this is providing that if a student or a minor, because in this statute it doesn't define a minor as an age, who is living separate or apart from their parent or legal guardian, would not need to abide by the Parental Bill of Rights.
Representative Gillman.
Thank you, Chair. And I believe the term is emancipated minors. So, yes.
Okay, we're going to go to the next representative. We have Representative Carroll.
Thank you, Chair. And I was just going to add that point, and
Okay.
Representative clarified that.
Okay,
There's a
good.
legal classification called emancipation for minors, and it's a process you go through to be relieved of the control of your parents.
Okay.
You're on your own, you're emancipated.
Okay, so thank you for clarifying that. Appreciate that. We have our final question comes from, we go circle back to Representative Bierman on the Zoom. Go ahead, Representative Bierman.
Hey, Mr. Chair. Two things. Number one, I'd like to request a roll call on this, please. And then also, we had Deputy Commissioner Underwood up at the table a moment ago, and I just wondered if we could indulge bringing the Deputy Commissioner back up to just speak about what has been such a big topic today, which is parental notification on delivered health care for adolescents and youth, please.
Again. Okay. First of all, roll call requested. Roll call has been granted. You have the floor. Again, state your name, and if you could help with that question from Representative Bierman, we would appreciate it, Commissioner.
Sure. Thank you very much, Mr. Chair. Again, for the record, I'm Wendy Underwood, Deputy Commissioner of the Minnesota Department of Health, and appreciate the conversation today. I guess to Representative Bierman's question, the Department of Health does continue to have grave concerns about the confidentiality challenges within this bill. We know, just for those of us in the room and from our own experiences, that confidentiality affects our entire healthcare experience. From choosing to seek healthcare and meeting with that provider, and then the decisions made. And we know that this confidentiality is really important in the healthcare of adolescents if they are able to give their own consent and feel assured that their health information will remain private. And the sensitive topics that we know are addressed in these situations range from alcohol and tobacco use or drug use, eating disorders, mental health needs, or questions that a kid is just too embarrassed to ask their parents, as well-meaning as their parents may be. But those questions, if not asked and instead kept private, could lead to greater problems, which then affects that adolescent even more and that family even more, and compounds for greater public health concerns. And then also the items raised by the testifier, Ms. Beecham, earlier. So I did do a little just looking on my own to appreciate the conversation and learned a couple of interesting things that data shows that about the users of like school health clinics and having these private conversations. And data shows that youth from higher income family households are more likely to have these conversations. And also, interestingly to me, youth tobacco users are more likely to have these private conversations. So I think appreciating, who this is benefiting and how is really important to the conversation. Not sure if you have anything else, Mr. Chair.
No, and I would encourage you, if you have that data, assuming that you do, if you could share that with the committee.
Yeah, absolutely.
We'd share it to Mr. Carter, and he can get that out to the committee members. So we want to always make these bills the best that they can be. So Representative Bierman, do you have a final question?
Thank you. No further questions on that. Just I wanted to thank the Deputy Commissioner Underwood for coming up and speaking about that issue. It's such an important part of this discussion, because unfortunately, fear of parents is unfortunately sometimes a real thing. And physicians, if as a parent, if my child didn't want to share with me, I would certainly want them to be sharing with a trusted counselor or trusted medical professional to get the answers that they need to move forward and be healthy. So, and I've just will say I've heard this bill also in education, and repeatedly it seems to bring up more questions than answers. So I think it does have a long ways to go, and appreciate the committee's work in kind of dissecting it a little bit more and asking some really good questions, and we'll see if we can get some answers in the days and weeks to come. Thanks so much.
Yes, members. Yes, I appreciate this dialogue. One thing I do want to say before I turn it over to Representative Gillman, where the family goes, the nation goes. So this is such an important topic, and thank you, Representative Gillman, to bring it through this process so we can make it better. And with that, Representative Gillman, please close on your bill.
Thank you so much, Mr. Chair and members. I appreciate you all in the room. It's been given me a lot to consider going forward, and looking forward to making the bill better. And it has already, so I'm excited about this process. Again, House File 22 is about protecting parental rights and recognizing that parents, not government agencies, are the best positioned to make decisions in the best interest of their children. Minnesota already upholds many of these rights through existing statutes, and this bill strengthens those protections while ensuring necessary safeguards remain in place for children. At the end of the day, no one loves, protects, or advocates for our child more than their parents. That's the foundation of this bill. That's why I brought it forward, and I thank you and look forward to working with you all.
Okay, thank you, Representative Gillman. So we have a roll call. Ms. Colby, will you please take roll?
Chair Backer.
Yes.
Vice Chair Nadeau.
Yes.
Lead Bierman.
No.
Representative Bahner.
No.
Representative Carroll.
No.
Representative DePel.
Yes.
Representative Elkins.
No.
Representative Franzen. Yes. Representative Gillman.
Yes.
Representative Hemmingson-Yager.
No.
Representative Hewitt.
No.
Representative Knutson.
Yes.
Representative Liebling.
No.
Representative Mahmoud.
No.
Representative Perryman.
Yes.
Representative Purcell.
Purcell, no.
Representative Rapinski.
Yes.
Representative Ryer.
No.
Representative Schumacher.
Yes.
Representative Van Binsbergen.
Yes.
Representative Zalesnikar.
Yes.
Yes. Okay, there being 11 yes and 10 nays, the motion prevails. And this will, it will be referred to State Government and Finance Committee and State Government and Finance as amended. Thank you, members. Okay, next on the agenda, we have House File 89 from Representative Bahner. So you can come to the table there, please. And Representative Bahner, would you like to move your bill before the committee?
Yes, Mr. Chair, I would love to move House File 89 before the committee.
Thank you, Representative Bahner. And for the committee's awareness, we will be laying the bill over for possible inclusion in an omnibus bill or for further action at a later date. Now, Representative Bahner, to your bill.
Thank you, Mr. Chair. Hopefully this will be quick and painless. This is a fairly simple bill, Chair and members. A few years ago, we performed some cleanup of the physician assistant statute, Minnesota Statute 147A. However, since that time, we have found a lack of clarity in interpreting the out-of-state training requirements for physician assistants. Currently, Minnesota recognizes the training received by all healthcare providers, including physicians, physical therapists, nurses, and other healthcare professionals who completed their training elsewhere before moving to the state. The Minnesota Board of Medical Practice is authorized to license and regulate physician assistants and enforce their Practice Act under 147A. This simple bill allows the Board of Medical Practice to recognize the training a PA has received in another state in line with all other healthcare professionals. In your packet, you'll find a letter from the board confirming the bill is in line with their intent. In their business meeting dated January 11th of 2025, the board passed a motion to support the proposed changes to clarify Minnesota Statute 147A.02, Item C, allowing for the board to recognize the required 2,080 collaborative practice hours a physician assistant must complete in order to receive a license in Minnesota or any other state or United States territory. I ask for your support on this clarifying language to mirror the intent of the state. To the best of my knowledge, there is no opposition to the bill, but there is a letter of support in your packet from the Board of Medical Practice. I do not have any testifiers with me today, but I certainly do have folks available to answer additional questions if there are any.
Thank you, Representative Bahner. Would anyone from the public like to testify? Okay, so public testimony is closed. I open it up to questions for members and discussion. It looks like they love the bill.
I agree.
Oh, I'm sorry. We have Representative Dole. Representative Dole,
Thank you.
You have the floor.
Thank you, Mr. Chair, and I can't let a Representative Bahner bill go without saying something. Representative Bahner, this is a great bill, and I look forward to voting for it today and passing it off the House floor. So thank you for carrying it.
Okay. Any other members? Oh, Representative Liebling, go ahead, please.
Thank you, Mr. Chair. To that point, Mr. Chair, I mean, this is a bill that we could pass to the floor and probably pass off the floor with a lot of bipartisan support. Just saying, if Representative Nadeau wants to vote for it, he's not going to get the chance unless we change it and make a motion to re-refer it, I think, to the general register. I don't know that it would have to go anywhere else. It has no cost. Just a suggestion. Representative Nadeau, if you want to vote for it, we could be doing that today.
So yes, thank you, Representative Liebling. We are going to be laying this over to make sure there's no other concerns, and that's also for further consideration. So we're keeping the door wide open. Okay. So we have some feedback from the audience, it sounds like, too. So anyways, seeing no further discussion, Representative Bahner, please close on your bill.
Thank you, Mr. Chair. I will just say thank you to the members. Thank you for your support. And I would like to also confer that I would like to move House File 89 to be laid over and possibly be considered for the floor.
Okay, well, thank you so much, Representative Bahner. The chair lays over House File 89 for possible inclusion in the omnibus bill or for further consideration at a later date. And members, thank you so much for our discussion today, and seeing no further business before the committee. Our next hearing is Monday, March 10th, and we are adjourned.